the bills in Congress that I'm watching, assuming that we are that the Congress is able to avert a shutdown, are focused. I'm focused a lot on looking at drug price bills. There's bills in four different committees, or four different committees have held hearings to discuss the challenges around drug prices. Most of those bills are focused on and target PBMs, the pharmacy benefit managers. A lot of the issues there and a lot of the provisions are specific to transparency and competition. So they're looking to increase transparency around how pharmacy benefit managers, which are the middlemen between the insurers and between the drug companies and the insurers or the patients. The three largest PBMs control 80% of the market. And one of the things that Congress would like to look into is whether the consolidation of PBMs in terms of being owned or merged with health plans and pharmacies is a problem. Essentially, a PBM can pay its own pharmacies what it wants and pay independent pharmacies a different amount. So that's something they'll also be looking into. You can see in these lawsuits, there has been a whole lot of pushback on CMS for bringing up these provisions, and they are suggesting that this isn't really price negotiation, that this is more of price fixing, price setting. So we will definitely be seeing that argument in the courts, along with concerns about stifling innovation. The doctors and nurses and all of healthcare has been affected now by the pandemic. So they feel, the physicians I've heard from feel like this is kind of a slap in the face, given how hard they worked and how much they, did put their lives on the line during the pandemic to help and see patients. One of the key problems in terms of building the nursing workforce is the lack of faculty. There are 85,000 qualified applications that are rejected every year for nursing. So if we want to build the nurse workforce, we need quality education, we need faculty there, and there should be some movement towards that. Even though we may be seeing a rebound now, nurse workforce issues are chronic and can continue.
Now, one of the things I will be watching is to see what happens with the Lower Costs, More Transparency Act that was pulled from a House vote yesterday. The House had planned to vote on that bill under the suspension of the rules. And that bill included PBM reform, hospital price transparency, some site neutral provisions, and funding for community health centers, a delay of the Medicaid dish cuts, which are set to go back in October 1st, and a few of the other, what we typically call the, healthcare extenders. So especially leading up to the end of the month, I'm going to be watching very carefully to see what happens with the funding for some of these health extenders, the Special Diabetes Program, the National Health Service Corps, and then, some of the graduate medical education programs. These programs are set to sunset at the fiscal year. So it'll be interesting to watch how that plays out. Everyone is looking at and paying attention to the numerous lawsuits. I believe it's up to 8 lawsuits over the drug price negotiation at this point. And there's discussion about how it looks like maybe those are heading towards the Supreme Court. That's what they might be geared towards. So that obviously is one thing everybody needs to keep an eye on. One thing that's going to be important to look at is tied more to what is open enrollment going to look like this year, considering CMS, if we remember last year, had started to crack down on advertisements around MA plans and what those can look like, and raising concerns about television advertisements in particular. And Congress had stepped in as well, with Ron Wyden in the Senate Finance Committee raising a bunch of concerns around this as well. So I think it'll be really important to see what open enrollment looks like and to see what the advertising around that looks like. There are consumer advocates who will say that there's not nearly as much transparency, and clearly some in Congress are coming down on that side as well, because as I mentioned, that Lower Costs, More Transparency Act has quite a few hospital pricing transparency provisions in it as well. And then there there are others who are saying that, you know, this is working and CMS is making changes, so we're gonna have to see. But the fact is that it is still difficult for an individual person to, let's say, go and look up to try and get specific price information about a specific service ahead of time based on their individual insurance information. That is still very difficult. And it's going to be a very busy last few months of the year, and what the landscape looks like right at this point in mid-September could be very different from what it looks like on December 31st.
I think the thrust, of course, of the Medicare drug negotiation program is really to save the Medicare program and therefore taxpayers money with what we spend right now on prescription drugs under the program. So I think that it's possible that patients whose Medicare plans, require them to pay significant copays for their medication, it's possible, of course, after starting in 2026, that they might see some relief. But I think probably in the closer or nearer term, really the thing that is going to provide patients more direct and probably noticeable financial relief is the $2,000 cap that goes into effect in 2025. We're only talking 10 drugs in 2026. Obviously, that list is going to grow over time, but really, this is just the start of this, and we're starting with a pretty limited, array of products. The second thing I would say is, there's a lot of litigation out there. 2026 is very far away. It is an eternity as far as what could happen between now and then, and whether this program even survives. Nursing homes, especially in rural areas, are very worried that this rule, is just, it's like insult to injury almost. They already have to deal with such thin staffing levels and say they don't have money to hire and find, even find professionals who can do this work. And this is just going to be a really added and potentially unsustainable burden for them to fulfill. So I do think, CMS clearly is trying to thread the needle between, doing something that they can claim is robust, even though there's disagreement about that, and also not sort of imposing standards that are really not sustainable. And then in the end, what if you have so many numerous exemptions that in essence, the regulation does not really amount to very much.